Welcome back to Ask Allison. Here's today's question. Hi, Allison. Is it recommended for therapists to hire a contract lawyer to draft new client paperwork, such as informed consents, notice of privacy policies, etc.? So before I answer this, I would love to thank Therapy Notes for sponsoring Ask Allison. They're the #1 rated electronic health record system available today. With live telephone support 7 days a week, it's clear why Therapy Notes is rated 4.9 out of 5 stars and on Trustpilot and has a 5-star rating on Google. Therapy Notes makes billing, scheduling, note-taking, and telehealth incredibly easy. And now, for all you prescribers out there, they also have ePrescribe. If you're coming from another EHR, Therapy Notes makes the transition incredibly easy, importing your demographic data free of charge so you can get going right away. Find out what more than 100,000 mental health professionals already know. Use promo code ABUNDANT at therapynotes.com for 2 free months. I would definitely recommend having an attorney look over your client paperwork. I did something wrong when I was starting out. I, with permission, copied a friend's intake paperwork. He was a psychologist, his dad was an attorney, and had made sure that his was airtight for him. I didn't know that different licenses in the same state needed radically different paperwork, nor did I know that the same license across different states required different things in their intake paperwork. Sometimes our boards like to just make it more difficult than is necessary. Imagine that. Nothing bad happened. It was just one of those things that years later, I was like, oh, oops. I'm a rule follower. Anytime I find out I was going against the rules, I feel like I barely missed going to jail. So there's a resource that I hear amazing things about that I'm going to link to. My friends Kate and Katie hired multiple lawyers to make the most stringent paperwork that apparently meets all the guidelines all at once, all over in the US for all the licenses. You can buy a paperwork package from them and save a ton that you'd have paid, like save a ton of money based on what you would have paid a lawyer to put all this together for you. So today's free worksheet shares the types of paperwork that all practices need and includes a link to Kate and Katie's paperwork packages. And here's the thing, on the surface, our paperwork feels like the kind of like CYA thing that we don't really get too excited about. It feels separate from our clinical work and more like a box we have to check. Kate and Katie have convinced me that it's not just some speed bump that we have to go over to get our practice running, and that our paperwork is like better than I thought. It does more than just CYA and communicate policies. It can be a part of the therapeutic process. So that is a long answer to your question. But it's because I think our paperwork has the potential to do more for us than most of us consider. If you need help building your practice, check out how you can work with us. We have support across the financial spectrum so that even people in agencies can afford to get into private practice. And we've got some really amazing, super supportive programs as well. So if you have a question, please feel free to DM me for Ask Allison, and I hope you're doing well for the rest of the day. Take care.